A person you've become familiar with, especially over the last 2 years as Kent County rolled out the COVID-19 vaccine, is retiring. Mary Wazensky, the County Health Department's immunization program supervisor, her last day is on the 15th. She joins us now. Congratulations, Mary, on the retirement.
Thank you. I appreciate that.
So when you look back over your career, what would you say you're most proud of?
I guess I've been a nurse for 45 years. So I really am most proud of the fact that nursing is super important to me, and all of the people that I've met, connected with, and helped over the years. It makes me smile to think about my career as a nurse. But in my public health career, I've been through several vaccine preventable disease outbreaks, but the majority of them were very short-lived, like H1N1 in 2009. I had a measles outbreak, the hepatitis A outbreak in Michigan. But by far, this COVID pandemic has been the longest that I've been involved with in my career.
Speaking of the pandemic, under your watch, the county had one of the best vaccination rates in West Michigan. That's according to state data. What do you credit that to, and what work do you believe still needs to be done?
I credit to the wonderful vaccine providers that we have in Kent County. On a side note, our childhood rates are very low right now. We have a lot of work to do, but we're still one of the best in the state. And I think that's because I've worked very hard over the last 15 years to build those partnerships. And we have so many committed providers to keeping the focus on the immunizations and on vaccine preventable diseases. I think that's one of the best things to come out of this pandemic were the partnerships that we established. We met weekly and then we met bi-weekly to make sure that we were all on the same page and that we were complementing each other, not stepping on each other's toes. So we worked together to look at the greatest needs in our community, some of the places where there might have been some disparities, and then as partners, we strategized on the best ways to roll out this vaccine for the people who live in Kent County. I'm very proud of that.
Now, you've been called a one-woman public health machine, sorry about that. When it comes to your educating the public on a lot of things, not just COVID, what drives that passion?
I'm very passionate about vaccines. It's one of the greatest public health achievements of the 20th century. In my nursing background and all of the research I've done, vaccines are safe, vaccines are effective, vaccines are preventing not just kids, but adults as well, from getting sick, from being hospitalized, and from dying. And I think the work that needs to be done, unfortunately, vaccines and a little bit public health have gotten a black eye during this pandemic. So I think a lot needs to be done in order to continue our education so that we don't fall into the trap of thinking that vaccines are harmful, that they don't, work. I'll never tell you a vaccine is 100% effective. I'll never tell you a vaccine doesn't have some side effects. But when you weigh the risks of the disease versus the benefits of the vaccine, I feel like it's my job to make sure people have the information they need to make the best possible decision.
All right, Mary, what comes next for you? I know you're probably excited to get a couple days off after a long 2 years.
Yeah, not setting the alarm for 6 a.m. I have a couple kids getting married, one this summer, one next summer. And then I am planning a week at the beach to just relax and read a book.
Sounds like a plan. Thank you so much for your time and congratulations again.
Thank you. Great to speak with you. Have a great day.